Go.
Before starting today's presentation, I'll show you one picture. There is one couple and they're getting married now in this photo. Can you notice some weird things in their wedding? Some might did and some might didn't. As you can see, there's no decorations like ribbons or colorful curtains, and there's no flowers. Usually there's a lot of flowers in wedding usually, and there's just two small trees next to them. It sounds a little weird that there's trees in wedding. And in general, women desire to have a fancy wedding because they think the wedding is the only one chance to be a princess in their lifetime. But this bride doesn't want to have flowery wedding. If there are lots of flowers in their wedding, this wedding will be the most terrible experience for her. Yes, she has anthophobia. Yes, she has anthophobia, the fear of flowers. Today's topic is anthophobia. I have three main points: anthophobia and causes and treatments. Then let's begin with the first main point, anthophobia. There are two subpoints in the first part, definition of anthophobia and symptoms. Let's move on to the definition first. Anthophobia is an abnormal and persistent fear of flowers. Anthos is Greek word, means flowers. Don't be confused with anthrophobia, the fear of people. Some people are afraid of all kinds of flowers, but while others are afraid of specific kinds of flowers. But not only specific kinds of flowers, but also any flower parts like stem or petal or stem can cause fear. This is petal and this is stem. These are the part of flowers. Next, I'll move on to the symptoms. Fear of flowers might seem to be strange things for ordinary people, but these are really serious problems for sufferers. Even though people who suffer from anthophobia realize that there will be no threat from flowers, but when they are facing with flowers or even thinking about facing, they get panic or severe anxiety. Symptoms of anthophobia is really similar to other phobias. I'll cover 6 major symptoms. Typical symptoms of anthophobia include shortness of breath, dizziness, dry mouth, and inability to speak or think clearly, fear of death, and finally, rapid heart rate. I've talked about symptoms, and let's move on to the causes. I have three types of causes. The first type is from negative experience. The previous negative experience with flowers or some terrible scenes in film and TV shows related to flowers, or even watching someone's fearful reaction, it can cause anthophobia. For example, if parents have anthophobia, then their child can be affected by their parents. And next type is caused by other phobias. Fear of germs. This is germ. Fear of germs make them people be afraid of dirty soil, and then they are afraid of flowers because flowers is usually planted in soil. And fear of bees or insects also cause anthophobia. In other case, the last types of cause is connected with medical problems. Plants can cause allergies or some skin reactions like itchy or atopy. And if suffer from this kind of disease because of flowers, then you will avoid flowers to keep you healthy. I've talked about three types of causes, and then let's move on to the treatments. there are two things in the last main point. First, I'll talk about medications, and then I'll move on to the two types of therapy: psychotherapy and cognitive behavioral therapy. Even if endophobia cannot be treated with medications, but it's possible to relieve symptoms of endophobia with anti-anxiety medications. Anti-anxiety medications such as Xanax, Lexapro, or Zoloft can help control fear of panic, or breathe normally, or can slow down rapid heart rate. But those medications only treat symptoms, so people need to do other treatments to treat their phobias. I have two options. First, psychotherapy is consultation with doctors and therapies to cure their phobia. And second, cognitive behavioral therapy is mainly focusing on changing sufferers' wrong mind, like, I'm gonna die when I see flowers. You know, you're not gonna die when you see flowers, because flowers can kill you, right? So with this therapy, sufferers can know they're not gonna die, and they're perfectly fine when they see flowers. Today, I've discussed endophobia, causes, and some treatments. And for most people, beautiful flowers make them happy. But for some people, flowers can be the horrible things that they want to put away from them. But it's real tragedy that they cannot enjoy those beautiful flowers. As I mentioned in the introduction, this bride doesn't want to have flowery wedding. She hates flowers because she has endophobia. But fortunately, so many treatment options can be available in this century. I hope everyone can be married with flowers with modern medical ways like medications and treatments. Thank you for listening.